I'm Glenn Gruenhagen, and I'm here to ask you, what are your options? Today I'd like to talk about and address mandated vaccines. First, I want to just say I am not a doctor or a medical professional. I have a number of concerns, but you ultimately need to do the research and come to your own conclusions. The latest being that the Biden administration wants to mandate vaccines across this nation for companies with 100 employees or more. Now, the interesting thing, that rule has not even been issued yet many companies with 100 employees or more are starting to implement mandated vaccines. I have an article here, and we have almost half the states in the nation that once that rule is issued for mandated vaccines, they will be filing a lawsuit federally against it. It's almost half the states in the nation. I recently had a conversation with a Minnesota doctor and a Minnesota nurse. Both of them have refused to take the vaccine, and they're being greatly pressured to take the vaccine now. They're going to refuse to do it, even if it costs them their employment. One of the things to understand is, according to the nurse that talked to me, a lot of the hospitals in our state are with a skeleton crew. She puts in over 60 hours a week. She's married and has children. She said that she's going to refuse the vaccine, and of course, if they decide to terminate her, there's going to be even fewer people, personnel at the hospital to take care of the patients. She also said that vaccinated nurses have told her that if the unvaccinated nurses leave the hospital or are terminated, they're going to leave because they cannot handle the pressure and stress of taking care of all the patients. So this is going to create a huge crisis in our medical system. Not only that, I've talked to numerous employees of businesses with 100 or more employees who are not going to be vaccinated, are going to leave. Many of these businesses, I've been told by these employees, are just barely have enough staff to operate. So this is going to have economic, medical, and other huge consequences if we go forward with this in this country. In addition to that, there's been huge demonstrations, not only in our country against mandated vaccines or vaccine passports, but also around the world. Two countries in particular you might want to check out would be France and Australia. Here are some of the concerns of the individuals about not taking a vaccine. The first one is the ingredients. Talking to the doctor here in Minnesota, he said that a number of ingredients that can be harmful to you in some of these vaccines. Now, other medical professionals deny that. In this particular doctor's case, he said there's fetal material from aborted babies that are in those vaccines. Again, other medical professionals deny that. But that's one of the concerns why he is refusing the vaccine. Another one, the concerns, is that the negative consequences of vaccines to people who have received the vaccine are being underreported or not reported, including deaths. Again, there's two sides to that issue. Some medical experts and individuals agree with that, others don't. And then you add to that the vaccine companies are free from any type of liability, and it does raise some questions and red flags. A third concern is the mandate of vaccines on school-aged children, even when the overwhelming amount of medical evidence shows that there's little need to vaccinate small children against the COVID-19. The next area would be nationally, we see Dr. Fauci being confronted by Senator Rand Paul on the origins of the Chinese virus and also funding the Chinese Wuhan lab with US tax dollars. More and more apparent that maybe the virus was released from that lab and that has spread around the world. In addition to that, we now have the Biden administration demanding that all our military personnel are vaccinated. And if they refuse, they will be given a dishonorable discharge. What that means is they will be cut off from all benefits for having served in the military. There are a couple of exemptions. that are in statute. One is a religious exemption, the other is medical exemption. However, they're not always being exercised in companies or even with the government in terms of these mandates. So one other development is that a federal judge in New York has just issued a temporary restraining order or a block on mandated vaccines for healthcare workers in New York. There were large demonstrations by healthcare workers against this, and again, a federal judge has just blocked the mandate, which I believe is a positive step. There's really 5 issues that have led me to the point where I believe vaccines should be optional. The first is the Biden administration's stand on illegal immigration. As many of you know, we got tens of thousands of illegals coming across the border. I personally support legal immigration that's vetted, but I oppose illegal immigration. It exploits illegals and it endangers our country in many ways. These illegals are coming in, they're not vaccinated, they're not even tested in many cases, and yet they're being spread all over the United States. So we have the Biden administration coming down with mandates on U.S. citizens, and yet hypocritically turning around and letting tens of thousands, hundreds of thousands of illegals in here, unvetted, unvaccinated, and without any type of mandate. Another thing that has led me to oppose mandated vaccines by actions of the government officials is allowing infected COVID-19 patients into nursing homes. Now we know Governor Cuomo mandated it in New York and had thousands of deaths in nursing homes because these are some of the most vulnerable. In Minnesota, I have an article here, Governor Walz allowed, and in some cases required, COVID infectious patients to be put into nursing homes. 81% of COVID deaths at one point in our state were in nursing homes. So why are we putting infectious patients into nursing homes? Not only was about 80% of deaths at one point in nursing homes, the other 19% of deaths were people with severe health problems. So that only left about 1% of deaths that were connected to people who were not in a nursing home or assisted living or with severe health problems. So this whole idea of lockdown has been a disaster. It hasn't helped the spread, and it's hurt our economy, people's lives exponentially. Another concern why I'm opposed to mandated vaccines is because we know the vaccines, those who are vaccinated, the effectiveness diminishes. We're talking about an additional booster now. And then we also look at countries like Israel with a high vaccination rate, and we see that those vaccinated are still getting the Delta variant or becoming infected. So this whole idea that unvaccinated people are causing the spread of the disease, I believe there are many medical experts that consider that to be seriously flawed. Again, it leads me to the point where I think mandated vaccines should be opposed. Another area that has been diminished or rarely talked about is natural immunity. I've had doctors, one of them my family doctor, tell me that if you had COVID, you have the antibodies and you have natural immunity. Natural immunity is going to be better than the vaccine, and it's going to last longer. Again, there's controversy about that, but the least we should be doing is discussing it. The last issue that I'd like to talk about is early treatment. I don't understand why the government is not promoting early treatment. And I'm talking about ivermectin, hydroxychloroquine, monoclonal antibodies. These are early treatments that can keep people out of the hospital. And yet the protocol that comes down from the CDC and even Fauci at times is to tell medical people, well, tell them just to go home, and then when things get bad enough and they can barely breathe, then they can come back and we'll put them in the hospital. I had a young lady visiting a doctor who talked about this. Why isn't early treatment being offered? And the doctor's response was money. In other words, vaccines are expensive. Hydroxychloroquine, ivermectin, and some of these other treatments are inexpensive. I do have a number of references you should consider. There's a Dr. Scott Atlas that is an excellent reference. Also, Citizens Council for Health Freedom right here in Minnesota is another excellent reference. Citizensforfreespeech.org is another. American Frontline Doctors and Frontline MDs. And Dr. Scott Jensen, who's also running for governor, is another excellent resource on the things that I have mentioned here today. We're Americans. We can solve these problems, but we need to have a full vetted discussion, and the government mandating that healthy people are locked down or mandating vaccinations, I believe is the wrong direction. And it's more political science rather than real medical science that can help solve this problem.